on what needs to be done in terms of implementation, undermine the integrity of the healthcare system. Consequently, the Ministry of Health, the National Health Insurance Fund, and the Kenya Medical Practitioner and Dentist Council have taken action to address these issues, including suspending facilities found guilty of engaging in fraudulent practices. Currently, the prevalence of medical fraud as per external actuarial analysis stands at 20%. It is important for stakeholders, including insurance providers, regulatory bodies, investigating bodies, and law enforcement agencies to collaborate and identify, investigating and prosecuting individuals and facilities involved in insurance fraud. By enforcing strict regulations, conducting thorough audits, and promoting transparency and accountability in healthcare delivery, we can collectively work towards combating fraudulent activities and safeguarding the interests of patients and insurance beneficiaries. The second question, has the government conducted an inquiry into this matter? And if so, could the Cabinet Secretary table the report of its findings? I wish to respond as follows, Honorable Speaker and members. I want to confirm that the Ministry of Health, the National Health Insurance Fund, and the Kenya Medical Practitioner and Dentist Council have been actively addressing cases of medical fraud within the healthcare sector. Through joint efforts and investigations, several facilities have been identified and subsequently suspended for engaging in fraudulent activities that compromise patient care and violate ethical standards. I would like to note that authorities have indeed taken steps to investigate and address instances of medical insurance fraud. Efforts have been made to scrutinize the practices of healthcare facilities, assess providers currently suspended by the National Hospital Insurance Fund Board. I have annexed the list on my response. As we collectively strive to uphold the integrity of the healthcare system and protect the welfare of patients and insurance beneficiaries, I encourage continued collaboration among stakeholders, effective enforcement of regulations, and clear communication to promote trust and accountability in healthcare delivery. Question 3, what measures has the government put in place to ensure accountability by healthcare facilities and to provide compensation to the victims of medical insurance fraud? Speaker and honorable members, the government of Kenya has implemented and is working on various measures to enhance accountability and combat medical fraud within healthcare facilities. Some of the efforts that the government has put in place is health facility census, and this we did last year in August. The government conducted a comprehensive census of health facilities to create a database that facilitates the monitoring and regulation of healthcare services. This initiative aims to identify and verify facilities to ensure compliance with standards and detect any unauthorized fraudulent practices. The second step or measure that we have taken is repealing of the National Health Insurance Act of 1998. The decision to repeal the Act and the enactment of the Social Health Insurance Act 2023 is a strategic move by the government to strengthen regulatory frameworks and enhance oversight mechanisms within the healthcare sector. By enhancing the Social Health Insurance Act, the government will introduce updated provisions that safeguard against fraudulent activities, improve transparency, and enforce accountability measures for healthcare facilities and providers. Honorable Speaker and members, I would like for the effort that they put in. Honorable Speaker and members, we have also we are in the process of procurement of a smart digital system. The government is in the process of acquiring a smart digital system designed to combat fraud activities. This signifies a proactive approach to addressing malpractices in healthcare delivery. The sophisticated digital system will streamline data management, facilitate real-time monitoring of healthcare transactions, and employ advanced analytics to detect anomalies or irregularities that may indicate fraudulent behavior. The system will be integrated with approved clinical guidelines to ensure patient management is standardized. Fourth is enhanced monitoring and enforcement. The government has intensified efforts to monitor healthcare facilities and enforce compliance with regulations. Enhancement of oversight through frequent inspections, audits, and performance of evaluations is going to enable regulatory bodies and the Social Health Authority to hold facilities accountable for adherence to ethical standards, quality care, financial, and transparency, thereby reducing the likelihood of fraudulent activities. Fifth, creating public awareness and reporting mechanism. The government is also focused on raising public awareness about medical fraud and encouraging individuals to report in healthcare facilities. The government will empower the public to play an active role. It may provide more detail if there have been compensations of victims of medical insurance fraud. Honorable Speaker and members, I submit. Thank you.
Thank you, Honorable CS. Professor Jenda, do you have any supplementary question? You have an opportunity to ask it too, but if you don't have, you are satisfied, good enough.
Honorable Speaker, I think given the response to the questions that are satisfactory, or I'm satisfied with the responses. The only follow-up question, Mr. Speaker, sir, would be for the CS to explain to the House the intended processes that underline the implementation of the Social Health Insurance Act, and whether the frameworks, everything has been put into place to ensure that the repeal of the NHIF Act 1998 will not affect Kenyan population. Let me put it that way. Will not affect those who are previously, who are beneficiaries of the framework of the processes under the Act.
Honorable CS, you can answer that one.
Thank you, Speaker and honorable members. Yes, indeed, the ministry has a process for implementing the Social Health Insurance Act. And for our starters, the ministry did gazette a transitional committee that has experts to ensure seamless transition from NHIF to Social Health Authority. The committee has been sitting for the last 3 months. It has developed a roadmap on what needs to be done in terms of implementation. Additionally, the ministry worked on regulations for operationalizing the Social Health Insurance Act. And indeed, the regulations were already approved and gazetted. So we are in the process of finalizing with the transitional committee to ensure that all matters are taken care of. And I want to assure the House that one thing that the transitional committee is ensuring is that the Kenyan should not actually notice that there has been a change from NHIF to social health them after every 2 weeks, so that I get appraised of the process. And our intention and our...
Not touching on the strike, so that I will give the CS opportunity to put the Senate and the country. So if you have a different angle, then I can give Senator Muma Muyeka.
Is related to the repeal of the NHIF Act. You have explained the good intentions and the plans you have in place to have a smooth transition to the new system. I wanted to ask whether you are aware that many Kenyans are still paying NHIF but not receiving services. We have many Kenyans whose NHIF cards are not being honored in many hospitals, and they are actually stranded. Are you aware of that, and what are you doing about that?
Honorable CS.
Thank you, Honorable Speaker and Senator, of Exchequer release to NHIF. But I want to confirm that NHIF and together with the ministry, we have been having engagements with most of the facilities which are around the faith-based facilities. We've had a meeting with them. The rural health providers, we have had a meeting with them. The private providers, we have had a meeting with them and given a commitment that they should continue to provide services because the claims will be honored. Speaker and honorable members, I would like to inform the House that it is really natural that most of the facilities, due to the transition, then they would be a little bit not sure whether their claims are going to be paid or not. And some are taking that drastic action of not providing services. But as a ministry, we are continuing to engage them. And as I said earlier, one of the things that the Transitional Committee is doing is to verify the claims, to verify the assets and liabilities of NHIF. So, Speaker and honorable members, I want to assure facilities that there is no cause of alarm. They do not need to disrupt facilities. That once they have provided services, their claims have been verified and reconciled, they are going to be paid once resources are available. I submit, Speaker and honorable members.
Thank you. Senator Chute Mohamed.
Thank you very much. Mine is not something like a question, but I wanted to express my gratitude towards the CS. And I want to take this opportunity to thank the CS and the team, specifically the Director General. On this year, the organization intends...
Senator Chute, what is your question?
Yeah, I'm
trying... I can hear you are leading a statement.
Honorable
Speaker, appreciate the ministry.
Yes, I'm trying to...
What is your question?
I want the people of Kenya to know that we appreciate what the CS is doing and this organization also.
No, ask you a
question. Excuse me. Can you protect me from these guys? Speaker? The Speaker is asking a question.
On the members.
So...
On the members.
And Mr. Speaker, this is
you have an opportunity to ask to do that statement even later. It's kind of because of time. Just ask the question and then...
Honorable Speaker, as I finish, I want Kenyans to know that what the Cabinet Secretary and our team are doing, and this is very important for me and most of the Kenyans. And also, Honorable Speaker, I hope and believe that the CS is capable of solving the dispute between the doctors and her ministry. And thank you very much, Honorable Speaker. Asante sana.
I give you some good guidance, and now you are still diverting from my advice. So let us, there was no question at all. So let us have Senator Onyonka, Richard.
Somebody I've known in my previous life, and I'm happy to see her here. The question, Madam CS, that I'm asking you is this. The NHIF Act has been repealed. You have several health facilities and health centers all over the country. Some of them who have not been paid for the last 5 years. Some of them have not been paid for the last 3 or whatever number of years. And what many of these Kenyans are asking is whether you have done an audit. And this audit is meant to give you the list of the outfits or health facilities or companies that have been providing these health services to our people. And if so, is it possible for you, for the simple purpose of accountability and transparency, to give the list within the regions where these companies come from, so that by the time you are transitioning to the Social Health Authority and you are transitioning with the healthcare fund, my suggestion, Mr. Speaker, is that this would make it easy for these Kenyans, many of them who are complaining and saying how they've never been paid and their things are being taken by auctioneers, and many of them have actually been disenfranchised. I hope the CS will be able to look at it and give us an answer on that.
Okay, let me get 2 more, then the CS can respond. What is your point of order, Senator for Kiambu County, Karungo?
Mr. Speaker, thank you for the opportunity. I am rising on a point of order 51C, 6C, that you had indicated that you might give the CS permission to give a statement on whatever is going. Some of us, we do have questions to ask that. So my question is, or seeking your indulgence, you probably give the CS this particular moment to give a statement, Probably the questions that we want to ask are in that statement.
I give a very clear guidance to Senator Karongo Dango that I wanted to give a few senators to ask supplementary questions on the subject matter on this question. And then I'll give the CS an opportunity still now to make a statement. I don't know whether you are the one who is in a hurry or the CS or myself, and I'm not.
Honorable Speaker would have sorted, including Isiolo's process. So we would like to know, in the transition period process, what is the department doing to make sure that the payments are being made, and what is the ministry itself as a mother ministry doing to pay the debts they owe to the defunct NHIF, including State Department of Public Service, for wiper amounting to millions of money, to make sure that those debts are paid before the process, the new process begins. Thank you, Honorable Speaker.
Yeah, Madam.
Before the new process begins. Thank you, Honorable Speaker.
Yeah, Madam CS.
Repealing of NHIF Act. I think it is now clear that we are in the transition phase, and years, and even others that are longer than the 5 years. What